In the 1940s, thousands of African Americans were employed in Henry J. Kaiser's shipyards, located in the Bay Area. The government awarded Kaiser contracts to build 3 of 17 Liberty ships named after prominent African Americans: the SS George Washington Carver, the SS John Hope, and the SS Robert Abbott. Henry J. Kaiser was known for being a progressive businessman who hired workers regardless of skin color. He maintained the same attitude when it came to delivering the Kaiser healthcare system. He declared that there is no segregation at our facilities. Today, Kaiser is recognized for its diverse culture. Hello, I'm Greg Adams, President of Kaiser Permanente's Northern California region. Each year in February, Kaiser Permanente, along with millions of Americans, celebrates Black History Month. During this time, tribute is paid to those who made achievements and contributions, both past and present, to help strengthen us all. Kaiser has a very rich Black history, beginning with James Toth Shaw. James was Kaiser Permanente's first Black employee, and continuing with Wendell Lipscomb. Wendell was our first African-American physician who started his internship in 1951.
Wendell Lipscomb was the first African-American physician who interned at Kaiser Permanente in 1951. Wendell Lipscomb earned his pilot's license at the age of 16. In World War II, he was a civilian instructor in the Tuskegee Airmen. He spoke 4 languages. He was a talented musician, philanthropist, owned an art gallery, and he was a very successful psychiatrist. In 1959, he founded the Alcohol Research Group. He was a remarkable man who truly made a difference.
That name sounds familiar, but I just don't know.
Sounds familiar. LMA.
No, she doesn't look familiar.
Oh. It's the name sounds familiar, but I'm not sure.
I don't know her either. But if you give me about 10 minutes, I can Google it right.
I don't specifically.
Dr. LMA Simmons is?
I did not know before today. How embarrassing.
She was the first African-American doctor, a female doctor that worked for Kaiser Permanente.
Yes.
Okay.
That's wonderful. That's really good. That's really good.
That's right. She is. Amen. Yeah. Yeah. I remember reading that on my email.
Wow. That's
93 years old.
93? She looks good for her age.
Yes, she does.
I heard, amazing. You've heard? I've heard, but I haven't seen a picture.
Yeah.
My name is Alvin Wheeler, the Physician-in-Chief for the Kaiser Permanente Greater Southern Alameda Area, Fremont, Hayward, California. And it is a distinct pleasure of mine to speak with and have dialogue this morning with a dear friend, Dr. LMA Simmons. And Dr. Simmons brings rich history to the Permanente Medical Group and to Kaiser Permanente. So Dr. LMA Simmons was the youngest of 4 children who was born in Mount Vernon, Ohio. And she was born on March 26, 1918. Thank you. She had an aspiration that far surpassed so many of her colleagues back in that day. Desiring to go to college, desiring to become a physician and a nurse, she was able to accomplish many of those things. Get her master's in social work, and then eventually end up at medical school at Howard University in spite of her desire to go to Ohio State University, which was her home state. And then later, another first, she was actually the first African American nurse to serve in the U.S. Army Nursing Corps. Also became the first African American to live on campus at Ohio State University while doing graduate work. Turns out that years earlier, when Jesse Owens was attending Ohio State as a distinct athlete and won gold medals, she thought since he had attended there, she could go, only to learn later that actually he was not allowed to live on campus. He and other African American athletes had to live off campus. She went on to train in allergy, asthma, and immunology at the National Jewish Hospital in Denver, Colorado. Was the first African American female to have such training, and went on to become the first African American female physician hired by the Permanente Medical Group and Kaiser Permanente in 1965. So, Dr. Elamé, it's such a pleasure. I tried to provide a little bit of a summary. Now, having come and begun working at TPMG here in Northern California, you know, the hiring and supervising physician for you is well known across the country and around the world, Dr. Feingold. What was he like to work with?
You couldn't work with him, you had to work around him. He was a challenge.
Now, you mentioned in your earlier comments how your parents had had such a strong influence on you and your siblings, and how they were also impactful on the motivation to move forward in your career. Could you tell us a little bit about how their input affected your work ethic?
My parents expected perfection, and nothing less than perfection. My mother was a hard taskmaster. She especially expected perfection. And I tried to please her. It went beyond what I might have wanted. It was what she expected. My father expected the same, but with a more gloved hand. They clung to their religion. It was their survival. My mother was a Seventh-day Adventist. I might say rigidly so, and my father was Methodist, AME. He was a deacon. He was very active in his church. He loved his church. He loved his family, and he loved his church.
Given that you've been at Kaiser, in fact you've spent a career, just the latter part of your career, 25 plus years, how do you say things changed at Kaiser over the course of your career? I know that you also were able to meet and do some work with Dr. Granville Coggs, who joined TPMG after you had joined as well.
Well, it's obvious there were no black physicians. There was one black physician in the radiology department when I went there. It was Granville Coggs in the Department of Radiology.
Now, you know, the whole specialty of allergy and asthma sort of started early in the 19th or 20th century, actually. And by the mid-year, or just around the time you were starting to go to medical school, it sort of came to fruition. Tell us a bit about your specialty of allergy, asthma, and immunology.
It started in Denver at National Jewish. I really became interested in asthmatics as emotional component. Many doctors referred their patients who had been treatment failures.
Mm-hmm. And I'm sure you've seen many changes and advances over the years. What would you say has been some of the most significant changes that you've seen in this field of practice?
How much increasingly the sensitivity that is developed to new products is an improvement in diagnostic techniques. We're learning more and more, but we're realizing that there's so much that we don't know so far as treating asthma and allergy and the immune system.
Having had the many and varied experiences that you've had, what would be some words of advice that you would give to new and young physicians who are just starting their careers at CPMG?
Listen to what the patient tells you. Keep researching, and if you're interested in a substance, stick with it.